Rick and Sasha with George Wilborn, and we've been talking about this coronavirus, COVID-19, and how it's affecting the world. Now, Sasha, we just saw an RN from Mobile, Alabama.
Right.
Her name is Leslie. That's all. Can we just say your first name, Leslie? Should we say your whole name?
Yes, that's fine.
Okay, just Leslie.
We're
My
going to say
name is Leslie Taylor Jones.
Leslie Taylor Jones. Now, Sasha, she's an RN from Mobile, but she travels the world. And Leslie, right now, you are in what city? We can't say the hospital.
I'm in New York City.
You in New York City. Okay.
Wow.
So she's not going to say the hospital, but what you're seeing in that hospital as opposed to what's being reported, can you please share that with us?
Well, what's being seen in the hospital, it is an overflow of patients. It's so many patients coming in and they're actually sick. It's not a hysteria of everybody that's running in to be tested. Everybody who's coming in right now, they're actually sick and having symptoms. Everybody is short of breath. Everybody is coughing or having cough.
Oh my God.
People are having symptoms of splitting up blood.
Oh my
It's
God.
just terrible. It's something like that I never seen before. You know, in the wintertime, the flu season always bring an influx of patients in, but this is 10 times that.
Leslie, what happens if I come to the emergency room and I don't even have those symptoms? Maybe I have a broken leg. Where do I go? How do you separate the patients?
I mean, at this point in New York City, it's hard to avoid it. You know, everybody at this point is testing positive, even the staff members, even the nurses and the doctors. They have a fast track area for if you come in and you don't have symptoms of COVID. They're trying to put all the COVID people together. Just say you come in, not for a broken leg, but maybe just you don't feel well or you have a stomach ache. You have to come back to the back of the ED area where you'll get a full workup. But the area that you'll be in is surrounded with COVID patients. You understand what I'm saying? And all the patients are supposed to have their mask on. We provide masks for everybody who's coming into the ED, but the disease is airborne, you know, so it's really inevitable to get it when you're in that environment and you're not covered.
Right. So is it true that they are actually having y'all reuse your masks? Have y'all gotten to the point? Because I know some of them are.
Well, yes, that is the truth. I was provided an N95 mask and a surgical gown, and we used the same N95 mask and the same surgical gown for 5 days. But once we go in a patient room, you're supposed to put a cloth gown on top of your surgical gown, and you're supposed to put a plastic gown on top of your surgical gown.
Wow.
And 2 layers of gloves. So as you come out of the room, you remove your paper gown and your plastic gown, and you remove your top mask, and you remove your gloves and wash your hands. And you do it all over again to go to the next patient's room.
So on social network, I saw tractor trailers and them putting bodies in these tractor trailers in New York at New York hospitals. Is that true too?
It is definitely true. Everything you're seeing on the news is true.
Mm-hmm.
People are dying constantly. Like when I went to work the day before yesterday, it was 13 deaths. You know, the morgue is small. We never seen this influx of deaths at one time. So there's nowhere to put them. The bodies have to be at a certain temperature. So they brought the trucks in and they put cooling devices in the trucks, and they're storing the bodies in the trucks.
Wow. Mm-hmm. So they obviously it sounds like they're going to take these to mass graves because, first of all, there are no funerals. These bodies are infected with COVID-19, so they have to put them all somewhere together. Now, Leslie, you are a mother.
Yes, I'm a mother of 2. I have a 22-month-old baby and a 17-year-old son.
Mm.
We saw a nurse. She was asked to go to the COVID floor. She said, with her condition, I can't do it. I'm leaving the job. What keeps you going personally?
Well, what keeps me going is the fact that the patients really need help. I'm out here. We're relief for the nurses who've been here since the beginning. They've been here since the beginning, working day in and day out, long nights and long days, and they're seeing people that they know come in with the COVID disease, and they're taking it really hard. You understand what I'm saying? I'm a traveler. I don't know these people, but I see what they're going through. And just imagine if I was from here and I see my family members and my coworkers suffering from this COVID disease, and I just feel like I need to help. I need to be here. Now, I do have PPE because I'm an ER nurse, so I'm provided the PPE because I'm actually on the front line, so I'm always covered. So I feel as if I'm safe while I'm at work because I have what I need to protect myself against the virus.
Wow.
I know as a nurse that you see death, but you're seeing a lot of death. How are you emotionally? I mean, and all the other nurses and medical professionals, how are you dealing with that?
Well, at this point, all we can do is pray. I'm praying every day to the Most High God. My parents are praying for me. When we get off of work, we come in and we pray together. And I just have to do my part as a nurse to know I did everything I could do to make the transition for my patients easier because they don't have families by the bedside. The hospital right now are not allowing any visitors. So every patient that come in is alone. You know, they don't have their daughters to hold their hand. They don't have their spouses to hold their hand. And that's heartbreaking to me. So if I can come in and I can help ease the process for somebody, that gives me a sense of joy that I was able to help her and I was able to be there to hold someone's hand and to rub someone back and tell them that they're going to be okay and pray with them. That's what gives me peace and makes me come to work.
And God bless you. So what is it like going there every day knowing that there have been nurses and doctors that have been tested and have contracted COVID-19?
Yeah, that's quite a few nurses who've contracted COVID-19. They only test you if you show symptoms. The symptoms would be sore throat, cough, back pain, shortness of breath. I don't have any of those symptoms, so I don't have a reason to be tested at the moment. Now, the nurses who are tested, some of them are still allowed to work if they're able to. There's no cure for COVID-19. So we're treating the symptoms. On an X-ray, it mimics pneumonia, right? So they treat pneumonia with levaquin and azithromycin, different IV antibiotics. So that's what they're getting. They're basically treating the symptoms. You're getting cough medicine, you're getting Tylenols for the fever. That's what we're treating.
Wow.
So if it's not that far, we're not short of breath, you know, we're just going to give you your Tylenol we're going to give you Tylenol to break your fever. We're going to keep you hydrated and send you home.
Can you talk about the patients being on top of each other?
Okay. The patients being on top of each other, like I said before, is so many people coming with the same symptoms. So they're called rule out COVID. So that means no one has been confirmed, but they're placing them all in the same area until you're confirmed positive. And then you're moved to another area with a positive patient. Okay, just say us three were in the room together. We're all ruled out. And today my results came back positive. And then Sasha's results came back negative. But she's been in the room with me for two days. You understand what I'm saying? Mm-hmm. So if she's tested again, I'm sure she'll be positive. So I don't know what we would do to stop the spread of this. And it's not the hospital's fault. There's nowhere for the patients to go. It's not, the nurses are doing an amazing job. My hats are off to the New York nurses because they're working so hard every day. They're coming to work every day and doing the same thing over and over again, working basically short staff. We're here to relieve and we're still short staff. You get what I'm saying? It's just madness. But everybody's trying so hard. So I don't know what we could do as healthcare professionals to stop the spread because they're doing everything that they can do.
And 3 things that you need right now. What do you need?
I would say we would need scrubs. You know, it would be better if we could dress in and dress out at the hospital. Like if we just had disposable scrubs to put on so we won't have to work in those scrubs. Even though we're covered with the gowns, you still fit in the hospital with your scrubs on that you're going to go home in. So if we had a lot of disposable scrubs. So when we come to the hospital, we change in the scrubs, and then when we leave, we change out. So we're not even taking that back outside the hospital door. What else we would need? More supplies. We definitely need N95 masks. I know it's a shortage, but the hospital is short on everything: paper towels, gowns, gloves. It's just a shortage because they never seen this many patients at one time. So we need supplies. We need supplies. And the last thing I would say we need is prayer. We need everybody in the world praying for the healthcare workers and the essential people who have to be out here every day working with people who are COVID positive.
Right. Leslie, when will you see your family again?
Well, I don't know. I signed up for this assignment. It was 21 days. My 21 days will be up on April the 10th will make 21 days for me. And I have to quarantine for 14 days to make sure that I'm not, that I don't show any symptoms within those 14 days before I could go home.
Right.
Wow.
Well, Leslie, thank you so much. We're going to be praying for you and the other nurses, and kiss those babies for us and for yourself, and just keep them positive. And listen, while Mobile is listening to you, who'd you like to say hello to?
I would just like to say hello to my mom, Shirley Taylor, and my dad, Lester Taylor. My mom's also a nurse, so she's working in it as well. Keep her in your prayers. And my dad, who's home taking care of my kids, Cassius Taylor and L. Jones. And everybody who's praying for me, all my friends, everybody who's sending me care packages, they're keeping me stocked up on my vitamins. Thank you. My grandparents who are all praying for me, my aunts and uncles, just thank you all. Thank you for the support. Thanks to IG, social media, everybody who shared my story. Thank you so much.
Girl, we will continue to pray for you, and God bless you.
All right, y'all. It's Rick and Sasha with George Wilborn.